Systemic Inflammatory Response Syndrome, SIRS. What is SIRS? The Systemic Inflammatory Response Syndrome is the clinical manifestation of dysregulated immune responses to infectious or non-infectious stimuli. The term SIRS was coined in recognition of the fact that many clinical signs of systemic inflammation are common to different etiologies and that an infectious cause cannot always be identified. Pathophysiology of SIRS. It involves the release of acute phase reactants, which are direct mediators of widespread autonomic, endocrine, hematological, and immunological alteration in the subject. Even though the purpose is defensive, the dysregulated cytokine storm can cause a massive inflammatory cascade leading to reversible or irreversible end-organ dysfunction and even death. What are causes of SIRS? There are both infectious and non-infectious causes of SIRS. Some important ones are infection, sepsis, trauma, acute pancreatitis, tissue necrosis, transfusion reaction, vasculitis, liver failure, disseminated malignancy. What is the criteria of SIRS? 2 or more of the following criteria are to be met: heart rate more than 90 beats minute, temperature more than 100.4 degrees F, 38 degrees C, or less than 98 F, 36 C, respiratory rate greater than 20 breaths minute or PaCO2 less than 32 mm Hg, WBC more than 12,000 or less than 4,000/microliters or over 10% immature forms or bands. What is the use of SIRS criteria? The SIRS criteria are commonly used in emergency department settings as a screening tool to identify septic patients. Almost all septic patients have SIRS, but not all SIRS patients are septic. Following is a flowchart showing the progression of sepsis leading to shock. First step is SIRS, which predicts the risk of sepsis in the future. If there is a suspected or proven source of infection along with it, then it is called sepsis. The confirmation of infection is not important at this stage. Even a suspicion is enough to mark this as sepsis. A septic patient has lactic acidosis or systolic BP less than 90 or drop in systolic BP about 40 or more than 40, or organ dysfunction or hypotension or hypoperfusion, then the patient has developed severe sepsis. If hypotension is not treated by fluid resuscitation, that is, it has become refractory, then it means that the patient has developed septic shock. Multiple Organ Dysfunction Syndrome, MODS. There is also a term called Multiple Organ Dysfunction Syndrome, MODS, as the presence of altered organ function in acutely ill septic patients such that homeostasis is not maintainable without intervention.